Good morning. We will be reporting about Chapter 23 about viral exanthems. We are Group 1 and here are the members. Truly yours, Flores May Agkawili, Princess Joy Antonio, Carmelita Domincel, Keisha Alana Carlos, Divine Escobar, Evergeline Esteves, and Christina Felix.
Infections associated with maculopapular exanthem. Measles, rubiola. Measles is a common and highly contagious childhood exanthem associated with serious complications. The infection is seen worldwide. It is common among children and young adults, but the incidence decreased dramatically since a vaccine has been developed and used worldwide. The infection is limited to humans and there is no animal reservoir or host. The etiologic agent for measles is the rubiola virus or the measles virus that belongs to the family of paramyxoviruses. There is only one stable serotype. The virus is a single-stranded RNA virus with envelope. Mode of transmission. Measles is transmitted through inhalation of respiratory droplets. The infection is contagious even before the onset of symptoms but most contagious during the prodromal period. During the initial stage of measles, the patient develops high-grade fever with the 3 C's of measles: cough, coryza, common cold or runny nose, and conjunctivitis with photophobia. This stage is highly infectious. Pneumonia is most common and serious complications of measles, associated with very high mortality of 60%, especially in immunocompromised individuals. Otitis media is the second most common complication. Post-infectious encephalitis is a rare complication occurring in less than 1% of cases but associated with about 15% mortality. Subacute sclerosing panencephalitis (SSPE) is a very late and serious neurologic sequela of measles. Diagnosis of measles is based primarily on the clinical manifestation. Treatment is symptomatic and supportive. Prevention is done through administration of a live attenuated vaccine given in combination with mumps and rubella (MMR) at 2 years of age.
Good morning, everyone. I am Princess Joy Antonio, and the next viral exanthems is the rubella or German measles. Rubella is one of the common viral exanthems in childhood together with measles, chickenpox, fifth disease, and Drosola. It is a benign infection in children. However, infection can be more severe in adults, especially when acquired during the first 2 weeks of pregnancy, when organ development occurs. The etiologic agent, rubella virus, is a single-stranded RNA virus under the genus Rubivirus and is a member of the Toga virus family. There is only one stable serotype and humans are the only one host. Mode of transmission. The virus is mainly spread through inhaling respiratory droplets. However, transplacental transmission can also occur when a seronegative mother becomes infected during pregnancy. The clinical findings. The rubella virus causes German measles, also known as the 3-day measles. It manifests with fever, followed by the appearance of maculopapular rashes that last for 3 days. The rashes are pruritic and, unlike measles due to rubiola virus, do not undergo desquamation. Laboratory diagnosis. Diagnosis of rubella is based primarily on the clinical manifestations. Diagnosis is confirmed by presence of anti-rubella. Treatment and prevention. Treatment is mainly symptomatic and supportive. Prevention involves administrations of vaccine, MMR vaccine or the measles, mumps, rubella vaccine at 2 years of age as part of the immunization program for infants.
Hey everyone, I'm Carmelita Dimensa reporting about the Rousseola infantum. Rousseola is the most common cause of febrile seizures in children. Etiologic agent. 6 disease is caused by human herpes virus 6, HHV6, that belongs to the family of herpes viridae. It primarily infects lymphocytes, particularly CD4 T cells. The mode of transmission is still unknown, but respiratory transmission and oral virus secretion are most likely because the virus replicates in salivary glands. Rousseola manifested by sudden onset of high-grade fever, followed by a generalized rash that lasts for 2 days. Diagnosis of Rousseola is based on clinical manifestation. Its treatment and prevention is symptomatic and no vaccine is available. Next is the erythema infectiosum. It is a biphasic infection consisting of the lymphatic stage and immunologic stage. Its etiologic agent, fifth disease, is caused by parvovirus B19, a single-stranded DNA virus that belongs to family Parvoviridae, which is the smallest among the DNA viruses. Fifth disease is transmitted by respiratory droplets and oral secretions. This disease is based on the clinical presentation of the patient, and there is currently no specific treatment or vaccine available for this disease.
Infections associated with vesicular exanthem, varicella or chickenpox. Varicella is a benign, self-limiting, and highly communicable infection in children, but associated with severe infections in adults. Etiologic agent. The causative agent is the varicella zoster virus, or VZV, a double-stranded enveloped DNA virus that belongs to the herpes virus family of viruses. It infects mucophyseal cells and establishes latency in nerve ganglia. Because of the latency, the virus persists in the infected host for an indefinite period and produces recurrent infection. Zoster are shingles, or especially in elderly and immunocompromised persons. Mode transmission. The disease is most commonly transmitted by inhalation of respiratory droplets but may also be transmitted by direct contact with the lesions.
Herpes zoster, a disease occurring in adults or immunocompromised and caused by same virus that caused by chickenpox. Caused by reactivation of a latent chickenpox infection. First manifestation is a severe radicular pain over the skin and supplied sensory ganglia. Most commonly involved is the thoracic dermatome and may also involve other cranial nerve like the trigeminal, facial, or auditory nerve. Herpes zoster or shingles is characterized by a vesicular rash along the affected cutaneous sensory nerve. The virus can be treated by acyclovir. An attenuated live vaccine is available. The rashes are similar in appearance to the chickenpox but differ from chickenpox in two aspects. 1. Limited distribution to the skin, innervated by a single sensory ganglion. 2. The rashes are painful rather than pruritic. Most common complication is post-herpetic neuralgia, a form of prolonged pain that may persist for months.
Good morning, everyone. I'm Evangelina Esteves, and today I am going to report about variola, or also known as smallpox. Smallpox is contagious infection responsible for very high fatality rate worldwide before the 18th century. The process was relatively dangerous but greatly helped reduce the rate of outbreaks and epidemics. It was Edward Jenner who developed a live vaccine from cowpox in the 17th century. The last reported case was reported in Somalia in 1977. In 1980, smallpox was declared totally eradicated through vaccination. Success of vaccination is attributed to several factors, including number 1, there is only one stable serotype. Number 2, there is no animal reservoir and humans are the only host. Number 3, there are no subclinical state. Number 4, is easily clinically recognizable. Smallpox is listed as Category A bioterrorism, biowarfare agents by the Center for Disease Control and Prevention. Etiologic agent, a variola virus, a member of the human pox virus, largest among the DNA viruses. Mode of transmission. The primary mode of transmission is through inhalation. Direct contact with the lesion, dried virus, or contaminated materials like clothing. Initially presents with fever, malaise, followed by rashes, macular becoming popular, vesical, and eventually pustular. Lesions appear one stage at a time. Deep-seated lesions leaving permanent scars. Severe cases, lesion may become hemorrhagic. Laboratory diagnosis, the disease is easy to recognize based on the symptoms. Prevention. Methicillin, effective as prophylaxis but not for therapeutic purposes. The vaccine is a live attenuated vaccine. Smallpox has been totally eradicated since 1980 because of the success of vaccination.
Let's go to Chapter 19 Lab Activity. Case Study. A 3-year-old child was brought to the emergency room because of difficulty in breathing. The condition started 4 days prior to admission as fever, cold, cough, and conjunctivitis, with associated photophobia. 3 days prior to admission, maculopapular rashes were noted over the face and trunk of the patient, which later spread to the extremities. Immunization history. The patient has been given OPV and the BCG immunization during the first year of life. What is the most probable diagnosis? The answer is measles. How is the disease transmitted? Through inhalation of droplets. What do you call the pathognomonic enanthem associated with this disease? The answer is the complex expand. Where is it located and how is it described? It is described as appearing like grains of salt over the inner cheek. What are the most common complications associated with this infectious disease? The answer is pneumonia. How is the disease prevented? The answer is vaccine. Differentiate rubiola to rubella. Etiology: rubiola is paramyxovirus, while rubella is togavirus. Common name: rubiola is measles, while rubella is German measles. Mode of transmission: rubiola is inhalation of droplets, while rubella is inhalation transplacental. Enanthem: rubiola is complex spot, while rubella is Forschumer's spot. Exanthem: Rubiola and rubella is both maculopapular. Conjunctivitis, rubiola is present conjunctivitis with photophobia, while rubella is absent conjunctivitis with photophobia. Post-auricular lymphadenopathy, rubiola is none, while rubella is present. Arthralgia, rubiola is none, while rubella is present. Congenital viral infection, rubiola is no, while rubella is yes. Vaccine, rubiola and rubella is both yes.
So let's go to number 3 in lab activity, which is differentiate varicella from variola. And these are the features. Etiology. In varicella zoster virus, while variola is variola virus. In common name, it is chickenpox in varicella and smallpox in variola. While mode of transmission is inhalation, they are both inhalation and direct contact. While inhalation, it is present in varicella but no scar, while variola, it leaves permanent scar. Distribution of lesions is crops of different stages in varicella, while variola is appear one stage at a time. And the severity in children in varicella is mild and self-limited, and whereas adult it is severe, while in variola it is generally severe and can be fatal. In vaccine, they are both have vaccines.